I think that people are very fearful to admit to what mental health issues are, and I really like to take a moment to tell patients that mental health issues exist all around you, and they aren't weaknesses in personality, and they aren't something that should be stigmatized or should be considered something to be ashamed of. They are just like any other illness, and people get help for them all the time. I think people just don't readily talk about their mental health issues as openly as they would about diabetes or arthritis or heart problems, just because I think they're scared to be judged, and obviously it's a very private matter. But I think it's important to get help, because mental health issues, just like any other illness, can continue to get worse, and after a certain point is not as treatable as it can be when it's first detected. People are meant to be humans, and being human means that you have all kinds of emotions. It's normal to be happy, to be sad, to be angry, to be anxious, to be scared. All the emotions are normal, and we expect people to have them. As mental health providers, our goal is not to make people zombies and get rid of these kinds of things, but our goal is to try and help people be more functional with them. It is normal to have these reactions, but it is problematic when it starts to cause dysfunction in your life, where it's affecting your home life or your relationships or your work life. I think that's when people need to recognize that they need to get help, is when it's exceeding that range of normal functioning. The downsides of not getting mental health treatment is one of the biggest ones, is that your illness could continue to progress and eventually cause more problems in other areas of your life that may or may not be repairable, like broken relationships, lost jobs, lost productivity, not being able to sustain a living. Secondarily, when patients suffer from mental health issues, they may not physically take care of themselves as well, so it can often cause worsening of other medical and physical illnesses if you have any. So I think overall it affects a person as a whole, and it definitely affects quality of life.